Thank you, Mona and Anne. Good morning, everyone. My name is Ayadela Anishe, and I'm the Deputy Director for the NAM Leadership Consortium, and I'm zooming in from the Piscataway Native Land. It is such a privilege for the Leadership Consortium to be working with the Robert Wood Johnson Foundation, and an absolutely amazing, to use a technical phrase, organizing committee to develop the Assessing Community Engagement conceptual model. We know that many of you have seen the commentary on the Assessing Community Engagement conceptual model, which was released in February. And during this part of the conversation, we're just going to quickly walk you through the foundational standards that were used to develop the model and some key elements of the model. If you'd like additional information and deeper insights into the development of the model and the elements, please feel free to go to the commentary. Next slide. To guide the design and the refinement of this new conceptual model for assessing meaningful community engagement, the organizing committee focused on 8 foundational standards. And these are the standards that you see reflected on this slide. In the interest of time, I'm not going to go through all of them, but we'll just highlight a few for you. One foundational standard for the conceptual model was really defining what should be measured in meaningful community engagement rather than focusing on what is currently being measured. And so we didn't want to be limited by what already exists in the literature, but wanted to be boundless by leveraging the wealth, knowledge, and expertise of the organizing committee to understand what real, true, meaningful community engagement looks like. Another foundational standard for us was really making sure that the community would be able to see itself in the conceptual model and to identify with the language and the definitions and the context that's being used in the conceptual model. For starters, we used a very broad definition of community, which was based on the CDC principles of community engagement work. And the organizing committee ultimately believes that the fundamental question is not whether entities or end users think they're engaging communities, but whether communities feel engaged. And that makes it even more critical for different communities to be able to see themselves in the conceptual model. At the same time, we wanted the model to be flexible and adaptable to meet the needs of a range of communities and other end users who might be using it. So if you are with federal, state, or local agencies, if you're with tribal communities, if you are in advocacy and work with community and are a community-based group, a funder, academic researcher, a payer, a health plan, or industry, we believe that this model is for you. Another foundational standard for us was really thinking about how we define health and wanting to define it holistically. The conceptual model should emphasize that individuals and communities have the right to thrive. We do realize that the conceptual model uses terms like health and healthcare, but we want to be clear that this model can be used by anyone whose ultimate work is to impact health. And so if you're in education, you can use this model. If you're in housing and transportation or food security, you can also use this model. And then the last foundational standard that I'll touch on is this need to embed equity throughout model. And I emphasize that this was a need. Equity cannot just be the goal or the ultimate outcome that we hope to arrive at for our work. It also has to be embedded throughout the decisions, the core components, and the processes involved in the model. And so for us in the organizing committee, it was really important to make sure that we were finding ways to emphasize the engagement of those who are hard to reach, but also those who are hardly reached in order to open the pathway to true transformation for systems of health. Next slide, please. So once we identified the foundational standards, we started spending time on designing and refining the conceptual model. On this slide, you'll see several of the prototypes that we actually went through in order to arrive at the final, near final version that we're going to be sharing with you today. The very first version of the conceptual model is the one that you see on the top left-hand corner. And this was the one that was developed by a subset of the organizing committee. With all of the boxes and arrows, you can tell that we are not designers. And so luckily we were able to have some design support from Kim Irwin and Tomoko Ichikawa at the IIT Institute of Design, who worked with the organizing committee and specific community leaders to develop over 10 prototypes and using a three-staged process. And so with their help, we were able to ultimately arrive at the model that I get the privilege of being able to walk you through today. Next slide, please. So we start with the central focus of the conceptual model, which is community engagement. Community engagement for us represents both the start and the hub of movement towards outcome. Next slide. Then we have the core principles, which identify the attributes that should be present in the process of community engagement. Community engagement is and should be grounded in trust. It should be designed for bidirectional influence and information flow between communities and partners. It should be inclusive, culturally centered, equitably financed, built on knowledge of communities and partners, and built with shared governance. It should also be ongoing, co-created, and co-equal. The process of engagement that uses these principles is critical and allows us to move to outcomes. Next slide, please. The outcomes that help to determine if meaningful community engagement is present are divided into 4 domains. Sometimes I've heard people refer to them as petals or propellers, and so you can choose whatever terminology works best for you. And then under each of these domains are the indicators. We know many of you are interested not just in understanding the indicators that you see here, but also the specific metrics that align with them, and those will be released shortly in the next few months. And so starting with the first petal or propeller, under strengthened partnerships and alliances, the indicators there highlight the benefits of strong relationships. And those indicators include diversity and inclusivity, partnerships and opportunities, trust, shared power, and structural supports for community engagement. Under the next petal, you see expanded knowledge. And here we see the creation of new insights and resources and stories and evidence. Indicators here include new curricula, strategies, and tools, bidirectional learning, and community-ready information. On the third petal, you see improved health and healthcare programs and policies. We identified indicators that allow for developing solutions that are fit to purpose, in that they are embraced and championed by those that they're designed to serve. And the indicators here are community-aligned solutions, actionable, implemented, and recognized solutions, and sustainable solutions. And then on the fourth petal, you see thriving communities. Here we identified indicators for physical and mental health, community capacity and connectivity, community power and resiliency, and life quality and well-being. Next slide. When community engagement is present, when the core principles are embedded into the process of community engagement, and there is movement both within and across these domains and indicators, we ultimately facilitate action towards health equity through transformed systems for health. As I mentioned earlier, the systems for health are inclusive of all systems that impact and influence health. We also know that there are several contextual factors that you see around the model that influence our work on community engagement. There are the drivers of health and the social determinants of health. There are the drivers of change in health, which are the key levers that influence stakeholder action and include things from grassroots organizing to regulations to financial incentives. And then there are the relevant social, political, racial, economic, historical, and environmental contexts that also underpins all community engagement efforts. Community engagement exists within all of these structural systems. And the organizing committee ultimately believes that true meaningful community engagement can shift not only outcomes in the model, not only health equity and systems for health, but true meaningful engagement also has the opportunity to shift these contextual factors as well. Next slide, please. And so the assessing community engagement conceptual model reflects what we know community engagement to be: dynamic and transformative. When communities are actively and meaningfully engaged, we can catalyze and accelerate the paradigm shift towards equity and transformed systems for health. Next slide. This conceptual model is only one of many resources that we plan to make available. It is the precursor to our, excuse me, to other resources. By June of this year, we plan to release impact stories, which demonstrate how partnerships and collaboratives have actually engaged communities and assessed their impacts. We will also release assessment instrument summaries, which are based on a literature review that we've been conducting and present specific metrics that are aligned with the indicators of the conceptual model. By the fall of this year, we will publish a National Academy of Medicine special publication that details our methodology for the literature review, the impact stories, and the conceptual model, and also details a framework for implementing and advancing how we measure community engagement. And now, excuse me, I'd like to turn the virtual microphone over to Cincy Hernandez-Cancio.